In this video, you will discover 6 things Medicare doesn't cover and how to get them covered. So stay tuned to the end, because this video is packed with crucial information regarding your healthcare and insurance planning. Before we dive in, if advertisements should interrupt this video, please do not click off of the advertisements. Please allow them to play through as a thank you to me for bringing you this honest, valuable information for free. Now let's continue. Are you one of the millions of Americans who are turning 65 or already on Medicare? If you are, you need to watch this video. Because what you don't know about your Medicare coverage could cost you thousands, or even tens of thousands of dollars. We're talking about a financial nightmare that can completely derail your retirement plans. I'm going to reveal the 6 major things that Medicare doesn't cover, and more importantly, the specific, simple steps you can take to make sure you do get them covered. This isn't about scare tactics, it's about empowerment. It's about giving you the vital knowledge you need to protect your health and your financial future. Stick around until the very end, because the last 2 points are often the most overlooked and can have the most devastating impact on your budget. I'm dedicated to helping you navigate the complex world of healthcare and financial wellness as you approach or enter your retirement years. Today, we're tackling a topic that is crucial for every single person who relies on or will rely on Medicare. The truth is, while Medicare is an incredible federal program that provides a foundation for healthcare, it is not a complete solution. It has significant coverage gaps, and if you're not aware of them, you could be left with a serious medical bill. This is why understanding your Medicare options is so critical. We're going to break down these 6 major gaps, one by one, and provide you with actionable healthcare planning strategies to fill them. Let's dive right into the first major area where Medicare falls short. Number 1. Routine vision care, the eye-opening gap. Did you know that original Medicare generally does not cover routine eye exams, eyeglasses, or contact lenses? Think about that for a second. Your health is not just about your body. It's about your eyes. Annual eye exams are crucial for detecting serious conditions like glaucoma, cataracts, and macular degeneration. Yet, if you're on Part A and Part B, you're on your own. Now, Medicare Part B will cover a diagnostic exam if you have a medically necessary condition, like if you have a cataract that needs to be removed. But for your annual checkup and a new pair of glasses, you're looking at 100% out-of-pocket costs. So, how do you get this covered? This is where your Medicare benefits eligibility becomes a strategic conversation. You have 2 main options to get vision coverage. The first is to enroll in a Medicare Advantage plan, also known as Part C. Many Medicare Advantage plans are comprehensive and bundle in these extra benefits. They often include an allowance for an annual eye exam and a portion of the cost for new eyewear. The second option, if you prefer to stick with original Medicare, is to purchase a separate, standalone vision plan from a private insurance company. This is a common and effective supplemental insurance strategy. Researching these plans is a vital step in securing your healthcare coverage for the long term. Routine dental care, the $1,000,000 smile cost. This is perhaps one of the most surprising and costly gaps in Medicare. Original Medicare does not cover routine dental services. We're talking about cleanings, fillings, extractions, dentures, root canals, and even dental implants. A simple toothache or a broken crown can quickly turn into a 4-figure bill or more. Poor oral hygiene is also linked to serious health issues like heart disease and diabetes, so ignoring this can have a domino effect on your overall health. This is a major issue in retirement financial planning. So, what's the solution? Just like with vision care, your best bet is often a Medicare Advantage plan with dental coverage. These plans typically offer a range of dental benefits, from simple cleanings to some coverage for more complex procedures. You need to be diligent when comparing plans and read the fine print to see what the coverage limits and copays are. Alternatively, you can buy a separate dental insurance policy. This is another crucial piece of the Medicare enrollment process puzzle. I can't stress this enough. Do not neglect your oral health. It is a critical part of your overall health and wellness. Number 3. Hearing aids and exams. The sound of silence. Imagine not being able to hear your grandchildren laugh, or the doorbell ring, or a car horn as you're crossing the street. Hearing loss is not just an inconvenience. It can be incredibly isolating and even dangerous. And yet, Original Medicare provides almost no coverage for hearing aids or routine hearing exams. This is a massive financial burden, as a single hearing aid can cost thousands of dollars, and many people need two. So, how can you bridge this gap and ensure you can stay connected to the world around you? Again, Medicare Advantage plans with hearing benefits are a primary solution. Many of these plans include a yearly allowance for hearing aids and routine exams, which can make a huge difference in your out-of-pocket costs. Another avenue to explore is to see if you qualify for assistance programs through your state or nonprofit organizations. It's also worth checking with your employer's retiree benefits, as some companies offer supplemental plans that include hearing coverage. This is a key part of choosing the right Medicare plan for you. Number 4. Long-term care, the retirement ruiner. Now this is a big one, and it's the one that can financially devastate a family more than any other. Original Medicare does not cover most long-term care, which includes custodial care in a nursing home, assisted living, or at-home care for daily tasks like bathing, dressing, and eating. Medicare Part A will cover a limited number of days in a skilled nursing facility after a qualifying hospital stay. But this is for rehabilitative care, not long-term custodial care. The average cost of a nursing home in the United States can easily exceed $100,000 per year. You can see how quickly this can wipe out a lifetime of savings. This is not a gap you can afford to ignore. It is a fundamental hole in the system. The best solution is a separate long-term care insurance policy. These policies can be expensive, and the premiums are often based on your age and health when you apply, so the earlier you consider this, the better. Another option, though not always ideal, is to self-insure, meaning you have enough savings to pay for care yourself. For those with very limited income and resources, Medicaid can be a lifesaver, but the eligibility rules are very strict. This is a critical discussion to have with your family and a certified financial planner as part of your comprehensive senior health care planning. Number 5. Prescription drugs, the donut hole and beyond. For years, the infamous donut hole, or coverage gap, was a major concern for people on Medicare Part D. And while the Inflation Reduction Act of 2022 has made significant strides in improving prescription drug coverage, with the donut hole being eliminated for 2025 and an annual out-of-pocket cap of $2,000, there are still crucial gaps to understand. The biggest is simply that not all drugs are covered by all plans. Every Part D plan has a formulary, which is a list of covered drugs. If your medication isn't on that list, you're paying full price. This is why comparing prescription drug plans is an absolute necessity. You need to look up your specific medications on the formulary of each plan you're considering. This should be a top priority during the annual enrollment period for Medicare. You also need to look at the different tiers of drugs and the associated copays. A generic drug might have a $5 copay, while a brand-name drug might have a copay of $50 or more. Beyond the formulary, there are still other potential out-of-pocket costs, such as deductibles and copays. Navigating these Medicare enrollment decisions requires careful research and planning. Number 6. International travel, the trip-stopping gap. For many, retirement means more time to travel and see the world. But here's another major shock. Original Medicare generally does not provide coverage for healthcare services you receive outside of the United States. If you have a medical emergency in another country, you could be left with a substantial bill. This is a huge risk, especially for those who plan to travel frequently. So what are your options for global medical coverage? A few Medigap plans, also known as Medicare Supplement Insurance, offer some foreign travel emergency coverage, though it often has limits. The more robust and reliable solution is to purchase a separate travel insurance policy. This is not just a luxury, it's a non-negotiable part of your travel planning if you're on Medicare. Look for a policy that specifically covers emergency medical care and medical evacuation, which can be astronomically expensive. This small investment can provide immense peace of mind and protect you from a potential financial catastrophe while you're enjoying your well-deserved vacation. So there you have it, the 6 major things Medicare doesn't cover and the practical solutions to get them covered. We've talked about routine vision, dental, and hearing care, the critical need for long-term care planning, the nuances of prescription drug coverage, and the often overlooked necessity of international travel insurance. Your senior care options and healthcare finance strategies are not one-size-fits-all. They require careful thought and proactive planning. I hope this information has been truly helpful and has given you a clearer picture of what you need to do. Taking these steps can make the difference between a secure, stress-free retirement and one filled with unexpected and overwhelming medical debt. If you found this video valuable, please do me a favor. First, subscribe so as not to miss our next value-packed video on healthcare and insurance planning, health and wellness. Second, click the thumbs up button to give us a like for bringing you this vital free information. And finally, comment below saying this was helpful and I love this video. Your feedback helps us reach more people who need this information. Thank you for watching. Disclaimer: the information in this video is for equipping, educating, and empowering, and is not professional advice. Please consult with a licensed insurance agent or a qualified financial advisor to discuss your specific situation.